Hello, my name is Jenna Petersen, and I am an Indiana State University LPN to BSN student. This is my clinical health education project for Nursing 444 Community Health. Today I will be discussing holistic assessments for patients with rheumatoid arthritis. After this activity, learners will be able to define rheumatoid arthritis, identify those with high risk for rheumatoid arthritis, explain the parts of a holistic assessment, explain how to integrate the holistic approach for patients with rheumatoid arthritis, and identify how your assessments are used to formulate personalized care plans. Please start by utilizing the links below to take a brief pre-test and open the included handout with a summary of today's teachings. Today we will be discussing what rheumatoid arthritis is, identifying the population at risk, what is included in the holistic approach, and how to use your assessment data for care planning. What is rheumatoid arthritis? Rheumatoid arthritis is defined as a chronic systemic autoimmune disease. It is noted for inflammation in synovial joints, which can cause physical changes in your joints such as deformities and elevated white blood cell count in the synovial fluids. Often it is found to have remission and exacerbation periods. Rheumatoid arthritis is known as one of the most disabling forms of arthritis. Rheumatoid arthritis can present in many ways. It often begins with nonspecific symptoms, symptoms such as fatigue, stiffness, general weakness, and loss of appetite. These symptoms gradually become more localized over time. Manifestations of rheumatoid arthritis include pain, stiffness, and limited range of motion and inflammation of one or multiple joints. It usually occurs symmetrically in smaller joints, such as in both hands or both feet. Larger joints, such as your elbows, knees, and shoulders, can also be affected, though rheumatoid arthritis does not usually affect the spine. Pain and stiffness is usually worse after periods of inactivity, such as first thing in the morning. In patients with rheumatoid arthritis, we may also see fever, fatigue, weight loss and anorexia, and increased weakness. Risk factors for rheumatoid arthritis and defining the population at risk. Who is the population at risk? There is no one cause of rheumatoid arthritis known at this time, but there are certain risk factors that put you at higher risk for rheumatoid arthritis. Those risk factors include age, as onset increases in adults over the age of 60. Rheumatoid arthritis is also found more frequently in women than in men. Birth is also a risk factor. Women who have never given birth are at a higher risk. There may also be a genetic component of rheumatoid arthritis. Those with a genetic predisposition or born with the HLA class II gene are at higher risk. Cigarette smoke is another risk factor. Those who smoke, those who were exposed to smoke early in life, or those with mothers that smoke are at a higher risk for rheumatoid arthritis. Obesity is another risk factor. The more overweight a person is, the higher their risk for developing RA. Holistic assessment and what is included in the holistic approach. The holistic approach is taking into account a whole person, mind, body, and spirit, and how all facets of their life will affect their care. Important parts of a holistic assessment include physical, psychological, sociological, developmental, spiritual, and cultural assessments. Care planning for rheumatoid arthritis patients and how to use your holistic assessment data. Holistic assessments for rheumatoid arthritis patients should include a physical assessment where you should assess for joint pain, swelling, range of motion changes, and physical deformities such as nodules. Your psychological assessment should assess for stress, mental health issues such as depression or anxiety. Sociological assessment should identify patients' support systems and certain family dynamics that may affect their care. Your developmental assessment can be used to tailor your care plan and teaching to an appropriate level so your patients can have increased understanding and compliance with their treatment. Spiritual assessment is important and may not only be religious, but spiritual practices that may impact your care. Cultural assessment is important as it may affect their diet preferences and certain practices that they may wish to utilize for their care of rheumatoid arthritis. There are a variety of holistic treatments for rheumatoid arthritis. Some may include a healthy diet. Depression, fatigue, and pain can all affect your appetite. Maintaining good nutrition can be difficult for those with rheumatoid arthritis. Topical medicines such as gels, patches, or creams can ease joint pain or muscle aches associated with rheumatoid arthritis. And complementary therapies can also be used. Meditation, massage, and acupuncture can ease the stress and anxieties related to chronic illness. For more information, please visit the CDC website or the Arthritis Foundation website. Now that we are finished, please take some time to use the link below to access the post-test. Thank you for joining me today on this presentation of the holistic approach to patients with rheumatoid arthritis.